Hello, hello. I'm so glad you are here. Hi, everyone. So many women are struggling with their health, their changing hormones, and their body. They don't know where to go. But every single woman is going to deal with menopause. So let's make this easier for everybody. Today, this is what we're going to talk about: what perimenopause and menopause are, what the symptoms of these conditions are, what your doctor can do for you, how to speak with your doctor with the resources so that you can get the help that you need, what to do if you don't have a doctor or can't find someone who will help you, and I'm going to give you my approach to perimenopause and menopause. First, let me introduce myself. I'm Dr. Annie Savage. I'm a naturopathic doctor. I'm the co founder of the Bay Wellness Center. I'm the founder of the Symptom Free Period System. I'm an associate at Balance Medical Center, and I write for the company Happy Mammoth. And it is really my passion to help women get through these transitions as easily as possible and without all the symptoms. Okay, so let's talk about what perimenopause and menopause actually are. The Menopause Society describes perimenopause as the time before natural menopause, characterized by changes in the menstrual flow and frequency due to the ovary's erratic hormone production and less frequent ovulation. The American College of Obstetricians and Gynecologists note that perimenopause refers to the years leading up to menopause, typically beginning in a woman's 30s and 40s, marked by fluctuating estrogen levels and changes in the menstrual cycle. Menopause, on the other hand, according to the National Institute of Aging, defines menopause as the point in time when a woman has not had a menstrual cycle for 12 consecutive months. This marks the end of her menstrual cycles. Then, the Menopause Foundation of Canada explains that menopause is confirmed after 12 months of 12 consecutive months without a menstrual period, signifying the end of a woman's reproductive years. But what does all this mean? What is happening to us as women? During perimenopause, these symptoms typically will begin in the mid 30s and can continue through menopause and beyond. So, what we're looking at is the change in cycle. So, irregular periods, hot flashes and night sweats, sleep disturbances or waking up through the night, mood changes with an increase in anxiety and depression, brain fog and memory issues, breast tenderness, increased PMS symptoms, a lower libido, vaginal dryness, weight gain or body composition changes, joint pain and muscle pain, worsening migraines, and heart palpitations. As for menopause, these symptoms can be very similar, and they can still include those hot flashes and night sweats, vaginal dryness and discomfort, urinary changes that can lead to more UTIs, vaginal infections, urgency and incontinence, sleep disturbances can continue, increased mood swings and irritability, cognitive changes, weight gain and metabolic shifts, skin and hair changes, bone loss or an increased osteoporosis risk, increased cardiovascular risk, and the loss of muscle and strength. According to the Mayo Clinic, the average age of menopause is 51 years old. Vasomotor symptoms like hot flashes can last on average 7 years, but can last up to 10 years following the last menstrual period. That's way too long if you ask me. So let's figure out how we can address this. How can your doctor, your family doctor, help you with this? You can absolutely go to your family doctor and ask for their help. Describe your symptoms if they allow for the time, and you can even ask, is this my hormones? Is this perimenopause? I'm really unsure. In our conventional medical systems, they are typically following an algorithm that they were taught in medical school. So they have to abide by this structure for testing, and they can get audited at really any point and have to prove why they've done those tests. So they have to have a good reason to do any testing or imaging. The caveat to this is that most medical doctors have not been taught anything about menopause. Currently, at the University of British Columbia, medical students are taught a total of 43 minutes on menopause. This is actually new. It was 0 minutes in the past, so we are in a better position. And there is a program being developed right now by doctors for UBC to begin teaching medical students a lot more about perimenopause and menopause, but it's not quite done yet. I tell you all this just so that you know your general practitioner may not have the updated guidelines and they may not actually know a lot about perimenopause and menopause. They have to do extra training to get that information, and they may not have done that yet. Your GP may offer you oral birth control or IUD insertions as a way to balance your hormones. Just so you know, this isn't going to balance your hormones at all. These are contraceptive options and they're not hormonal therapy. That being said, if it is your only option, this type of treatment can work for some women for symptom management, but it doesn't work for everybody. Antidepressants are also often prescribed for women during this time frame because of the mental emotional effects like that we mentioned. It's very common for women to feel this worsened anxiety, worsened fear, mood swings, irritability, some anger. A common phrase that I hear from my patients is that they just don't feel like themselves. They feel weird, out of body. They're acting like in ways that they never would act. So they feel very afraid of that. So, this option of treatment isn't a root cause, but like I said, it can be helpful for some people. GPs can also prescribe hormone therapy in the form of pills and patches, and these can be bioidentical options or they can be synthetic. Most would be covered by extended benefit programs, though. Once again, the caveat here is that your GP may not know the updated guidelines for these hormones and they may not have ever prescribed them before, so they simply may not know how. On the next slide, I'm going to talk about the resources that you can actually take to your doctor and help them understand your case a little better. And these are international guidelines so they can feel safe within their license. But at the end of the day, it is their license and their job and their livelihood, and they can still decide to do or not do this. As for testing, during perimenopause, the hormones are fluctuating so rapidly that testing isn't actually required to do a prescription. Personally, this makes me very uncomfortable, and I discuss this with all of my patients. Sometimes we test if my patient feels the same way that I do, and sometimes we don't, and we can just start that hormone therapy. That is really up to you and your practitioner. But in the conventional system, since it is not required, they may simply say no, because again, it goes back to that auditing process within the system that they work for. If you go to your GP during this period with fluctuating hormones, you discuss anxiety, chest pain, racing heart, often and hopefully you will get sent through for a full cardiac workup to rule out any cardiovascular disease. So oftentimes this looks like a Holter monitor, an EKG, and blood work to rule everything out. This is actually a good thing, but many people feel even more lost after when the response they get back is your heart's okay, everything is fine, you're just feeling anxious. Not a lot of people are then told, but this could be your hormones or this could be perimenopause. And lastly, why you should really advocate for yourself, not only so that you feel better inside your body and the way that you're living and your quality of life, but this is all disease prevention. We really want to have a long life, but a life of high quality. And cardiovascular disease, including stroke, is the number one killer of women in North America, beating out all cancers combined. We know that inflammation is the beginning of all chronic disease conditions. So we need to take care of our bodies early on and really get this under control before we're in a disease state. So one thing you should know is that in perimenopause and menopause, estrogen levels are going down. You probably already know that. But lower estrogen can lead to higher cholesterol. And that's why so many people are being put on these statin medications, because their cholesterol is high. So if we work within this balance of the body, we can avoid those medications, but also avoid cardiovascular disease and keep you feeling healthier and happier for much longer. So figure out your why, figure out what's important to you and why you want to feel better. These are the resources that I wanted to discuss as well. So we've got two institutions that do discuss the guidelines for menopause therapy and for hormone therapy. The old WHI, or Women's Health Institution, study from 2002 scared a ton of people, patients and doctors alike. We're still trying to unwind that poor interpretation and information that unfortunately was told to everybody. These are the updated guidelines from the Menopause Society. This used to be called the North American Menopause Society, just so you're aware. But they're recommending a personalized approach for every single woman. The age and timing of hormone therapy also, they say, benefits will outweigh the risk for most healthy symptomatic women under the age of 60 or within the first 10 years of menopause. The administration or routes indicate that we should be using transdermal or through the skin hormone therapy, because we can use lower doses and this reduces the risk of clots and strokes. The duration of use is not a set guideline. It is said that you can do continuation of hormone therapy beyond the age of 65 if there is persistent symptoms or we are preventing osteoporosis. We just need to do regular evaluations. Premature menopause, it's also indicated that we treat women who are in premature menopause at least until the natural age of menopause. And then breast cancer survivors, for select survivors, low dose vaginal estrogen can be appropriate when we need to treat because non hormonal treatments are ineffective. Next, we have the International Menopause Society. The guidelines are very similar. It is again discussing symptom management with hormone therapy, such as our vasomotor symptoms, which are hot flashes, as well as sleep disturbances. They do recommend a contraceptive consideration, because even if you are using hormone therapy, you may not be suppressing ovulation, and therefore we need to remember that we may also need a contraceptive as well. And again, they are indicating that we should have individual assessments for everybody. So at the end of this presentation, you'll get a follow-up email with these links so that you can discuss this openly with your practitioner. Will hormones solve all of our problems? No, unfortunately not. Hormones are fantastic. We should all have the option for them, and they do help with symptoms. But if you add hormones to a system or a body that cannot digest properly, eliminate, and detoxify properly, we'll end up in the same place as when we started. I've had many women come to me with the experience of needing hormones and getting them from another practitioner, and they feel amazing for a few months, but then their symptoms return and they don't know why. I understand this as needing to address that detoxification and elimination part in our systems. We have to address the adrenal system, which holds our stress response, the digestive system, and our nutrition to really get a full, well-rounded picture of care here. With the chronic stress that we live in and our adrenal glands not being able to function as well as we need as our hormones decline, that's where a lot of these symptoms come from. And we see this because we see worsened perimenopause and menopause symptoms in North America compared to other healthier places in the planet. Okay, what if you don't have a doctor? Then what do we do? In Canada, you could try to go to a walk-in clinic. You could also try the telehealth options that we do have now. Some of my patients have had success with doing this. But if you can't get any help within our conventional systems, you might have to step outside. So we do have functional medicine doctors as well as naturopathic doctors that can offer you a ton of help. The caveat being that a little bit more investment on your end will probably be necessary. These practitioners are typically outside the conventional system, and they would be covered by extended benefit care programs that you get through your job, as well as health spending accounts. And in BC, particularly, naturopathic doctors can prescribe medications and hormone therapy if they've done the training. This varies province to province, but BC naturopathic doctors have a lot of rights and control with the medications that they can prescribe. In the United States, the medical system includes functional medical and naturopathic doctors, all to be covered under their insurance. Typically, with functional medicine and naturopathic medicine, you are going to get that more well rounded program from those practitioners that you work with. So, this may be a better option for you if you can go that route. It may be a great option to have in conjunction with your general practitioner as well. So, I want to let you know my approach in helping women going through perimenopause and menopause. Like I said, my practice is focused on women's health. So, the conditions that I see day to day and work with for my whole career have been fertility, terrible periods, PCOS, endometriosis, perimenopause, and menopause. My approach is to address the root cause of these symptoms. Why is this happening? Why are we in such an imbalance? What I see is usually this is starting with inflammation. Inflammation is in our bodies and in our system because of simply the way we live, the foods that we're eating, the lack of movement of our body, the lack of sleep, as well as the ongoing and chronic stress most of us have. I like to start with the gut health because to me, that is our foundation. That is where everything is fed. We are either feeding disease or fighting disease with what we're doing, our daily habits, and what we're feeding ourselves. So I notice that when I address the digestive system and improve digestion and elimination, as well as detoxification, people feel immediately better, even before we give them hormones. This to me is the best first step. The digestive process includes our liver, our pancreas, our gallbladder. So we want to include all of those organs in our approach to optimize the way your body is dealing with everything, really. Then we can get very specific with nutrition. We can actually eat to balance our hormones, and we can eat and exercise along with our hormone rhythms so that we feel best. The hormonal balance actually starts when you first reduce that inflammation. That's why my patients are feeling so much better so quickly. When our digestion is optimized, we can absorb more of the nutrients that we're feeding ourselves, and our body can use them more efficiently. When our elimination and detoxification pathways are working, we can get rid of the toxins from our system, lowering that inflammation, and our body can naturally come back into a better balance. There is, of course, a time, a place, an age when we probably need to replace those hormones, and we will do so. This provides the protection for our brains, our bones, as well as our heart. And we cannot, cannot stop stressing this, that in this lifestyle aspect, we really have to address our stress, our cortisol, our sleep, our movement. This is all so, so important to everything else in our life. Everything is connected. So this is what I do with all of my patients in office. I address this digestive piece first. We add on the nutrition. We use the hormones as needed, and we make sure that we address the lifestyle, the actual way that you're living. I've also packaged this up and developed an online program so that you can use this in conjunction with care from another practitioner if you can't get in to see us at Bay Wellness Center. And that's everything. You're going to receive a follow-up email with the links and resources that we discussed here today so that you can take them to your doctor and have a really empowered conversation about everything. If you're local to Vancouver or to BC, we are available to help you at Bay Wellness Center through in-person care or telemedicine. And if you're looking for something to add on more care, more well-rounded care, alongside your general practitioner or another practitioner, the Symptom-Free Period System is an online program that is also available. If you have any more questions or need to contact us, let me know. My name is Dr. Annie Savage, and you can contact me at info@baywellnesscenter.com. Thank you.